2012. Now it is time to make healthy resolutions for a healthy new year. Dr. Leanne Flannery from Harbor Hospital is here to tell us how it can be done. Good morning. Thanks for joining us and Happy New Year.
Happy New Year to you, Candace.
All right, so in the first couple of days, we often take on these lofty goals that we have, but how do we go about just setting realistic resolutions?
I think it's an important question, and I think some of the traps that we often fall into are making decisions or changes that are too radical, not sustainable over time. So kind of the language that I use with my patients is just to shift your thinking away from diet to actually healthy lifestyles. So one of the things that we can do with our patients is partner in your discussing your plans and goals for the New Year's. And often it's making those small changes over time, incorporating them into your day-to-day that are more sustainable for you.
But one thing that I've noticed when you're talking about a lifestyle, I mean, literally, you're changing your entire mindset too, right?
Absolutely, and a lot of times, even though it's a physician-patient relationship, as a working mother of two and having just had my second child most recently, I try to break down what those barriers are. What are those obstacles for you to get to the gym and to make those healthy choices?
And I'm a mom too. I get it. You don't have time to go to the gym.
Absolutely,
you think you don't have time at least, but how do you go about maybe changing your life and working with people that are close around with you to make that time for yourself?
I think it's giving yourself permission to make your health a priority. Our First Lady recently spoke about how she puts herself above and sets her own health as a priority on her own list. And I think so often as working mothers, we don't put ourselves first. And it's giving ourselves permission to really carve out that time in the morning, whether it's the beginning of the day, initiating a walking club at lunch, going to the gym in the evenings. By doing that, for us being healthier, we then set examples not only for our coworkers, but our families and our significant others.
Well, great information. Of course, we want all of our viewers to, take it all in. You really have to think about it. And it doesn't just have to happen in these first days. I mean, you can gradually go about this, right?
Absolutely. And one of the things that I'm especially sensitive to are some of my patients in today's economy. The average unemployment rate now in Baltimore is 25%. So joining a gym and having that additional cost every month for some folks is impractical for them. A lot of the local malls have actually started a walking club, so that's another resource that I can share with my patients, and it's an option for many individuals that just maybe can't get to the gym or can't afford the cost of an additional gym membership.
Right, so truly, I mean, there is no reason why you shouldn't focus on you. You're the most important thing that you need to think about.
Absolutely, because when we start adopting healthy changes, people around you start noticing that something different is happening. What's the change? And that can be an opportunity to inspire and share those weight loss strategies with others around you.
Great. A healthy mind, healthy body goes hand in hand. Thank you so much for joining us. Great tips.
Thank you, Candace.